Hi, I'm Lisa Gill with Consumer Reports Best Buy Drugs. I'm here today with Dr. John Santa, Director of Consumer Reports Health Rating Center, and we're talking about ways in which Americans can cut their drug costs. We found in a recent survey that about 30% of consumers say they have taken potentially dangerous measures to lower the cost of their drugs. Can you give us some examples of things that Americans said they were doing?
Well, Lisa, this was surprising information and worrisome. Many patients are reducing the dosage of the medicines prescribed. They're splitting pills without their doctor being aware, and in many cases, they're not filling prescriptions. If consumers are worried about costs, it's time for them to have a heart-to-heart with their doctor. When they do so, it's almost always possible for a physician to look at the medications they're on and replace some of the more expensive ones with less expensive but equally effective alternatives. In some cases, they might find drugs that can be removed or replaced with, again, less expensive drugs.
Is cost something that patients should feel comfortable discussing with their doctor?
Absolutely. Patients can feel ashamed, embarrassed, reluctant to talk about costs, but it's important, particularly these days. No physician would be comfortable thinking that a patient is not getting the medications they need because of costs. And there's always alternatives that physicians can work with patients on to get those costs down.
Let's talk about replacements. Are there a couple of examples that we could give consumers out there of common replacements and perhaps less expensive replacements?
There's several. For example, if you're a person with high cholesterol, the brand drug Lipitor is quite expensive. In many cases, a less expensive alternative, lovastatin, can be prescribed and save you over $1,000 a year. If you're a person who has heartburn and you're on a brand medicine called Nexium, you can take omeprazole, which is over-the-counter, and get the same effectiveness and safety. If you have mild to moderate depression and your doctor is thinking about treatment, a generic drug like fluoxetine, formerly the brand Prozac, is just as effective as many much more expensive brand antidepressants.
And when is a good time to have this conversation in the part of when they're filling a prescription? Is it at the pharmacy counter or is it at some other point?
It's when you sit down with your doctor, preferably right at the start of your visit. Have that heart-to-heart. Let your doctor know cost is now an issue for you. They'll be happy to try and work with you on that.
For more detailed information on prescription drugs and how to lower your drug costs, please check out our website at consumerreportshealth.org.